All right, everyone. Storm Reed Physical Therapy, Latonya Mister here. We are here again with Dr. Barenburg, Dr. B, and today we're here to discuss part two, CBD oil. So go ahead and let us know, what is CBD oil?
Yeah, so CBD oil is essentially a product of, quote, industrial hemp plant. There's a lot of hype right now about CBD and marijuana, or cannabis, as we call it in the industry, with regard to medical applications. The key here to know is that cannabis plants and hemp plants, they're all the same. The government put in a blanket statement years ago stating that any plant that's in the cannabis family that has less than 0.3% THC is considered industrial hemp. So that's where that idea came from, that, oh, CBD comes from hemp plants. THC, or the psychotropic aspect, comes from cannabis plants. In reality, for the most part, they're the same thing. It's just a government declaration.
Gotcha. So your CBD oil comes from hemp?
Yeah, so in order for CBD oil to be legal in all 50 states in the United States, which it is, it has to be less than that 0.3% of THC, and it has to be harvested or extracted from industrial hemp plant.
Gotcha.
Right.
And do you have to use a carrier oil with your CBD oil? If so,
it depends. There's some people that use like a cold press system in order to just press the oil out. You get good yields there, but for the most part, everything that you see out on the market is going to be in a carrier oil, either MCT oil, coconut oil, avocado oil, something like that. We use spearmint oil as part of ours as well to kind of mask the flavor. It's important to remember that not all CBD is created equal. So a lot of times you'll see cheaper products that have what's called CBD isolate. And so what that means is, as they extract, as the manufacturers run through the extraction process, they pull out just the CBD by itself and concentrate that into a powder, and then mix that into oil and sell that to you. Most people would say, oh, that sounds like the cleanest option. You get rid of all the other stuff in the plant. Unfortunately, it's the least effective option. There's a very well documented effect called the entourage effect. It's found in both cannabis and CBD or hemp cultivars. Essentially, the CBD will work much better in its natural surroundings. The closer you get to the whole plant, the better the effect will be. And the reason for that is that the plant has other products like terpenoids and flavonoids and other chemicals there that work as a group together and really support the effect that the CBD will have in your body. So you'll see things out there like full spectrum cannabis oil or full spectrum hemp oil or broad spectrum. That's really what you want. You're going to pay a little bit more for it. The process is a little bit more involved, but the effect is a lot more dramatic and will be better for you in general.
Gotcha. Okay, so as far regarding pelvic floor, what conditions do you use CBD oil for?
So there's a ton of, so it's interesting because with CBD and cannabis in general, there's not a ton of data that's focused just on pelvic floor applications or women's health applications. What we have to do is take the data that's out there and use biologic plausibility to come up with a potential application in the pelvic floor space. So essentially what we're talking about is there's a lot of data out there right now with neurodegenerative disorders or neuromuscular disorders like MS, Parkinson's disease, Huntington's chorea, things like that, where people's brain and muscles don't function as they should. And they've used CBD and even cannabis to treat these patients to decrease spasticity, right? So their muscles become more pliable and relaxed. If you extrapolate that to pelvic floor spasm, you're kind of in the same realm there. Granted, no one's really looked at that, but there's biologic plausibility that you'd be able to relax those muscles in the same way as you would if they were, neuromuscular cause or skeletal muscle in your arm or your back or whatnot. So For women with really bad refractory pelvic floor spasm, I use this as an additive therapy to potentially avoid muscle relaxers that can be really sedating. This provides an option that women can use throughout the day, whether they're taking oil under the tongue, or you can actually buy CBD suppositories they can place vaginally or rectally. There are options there to kind of decrease the pelvic floor tone. Other places where we use it, there's a lot of data on the anti-inflammatory activity and the pain control activity.
Okay.
So you can apply that in the same way again to say, if we have bad pelvic floor pain, is it a neurologic cause? Is it sciatica? What's going on there? Or in bladder pain syndrome or interstitial cystitis, where we get this chronic inflammatory condition, CBD and THC for that matter has a really high biologic plausibility of being able to help these women. And in my practice, I use it quite a bit with interstitial cystitis and bladder pain syndrome and have pretty good response with that. In addition to all the normal stuff that is built into the general Western medicine algorithm. So in my practice, we tend to use it more as a additive therapy to the stuff that everybody else is doing in order to add another level of potential benefit there.
Gotcha. So for so your product CBD oil is taken orally or through suppository. Is there anything like topical that they can use?
There is, yeah. So
and all equal benefits, like there's the same amount.
Yeah, there's benefits of using certain application methods over others.
Okay.
So anything you take orally or under the tongue as a tincture, you're going to get a systemic effect. I mean, it's going to affect everything in your body. So if you get migraines or you have anxiety or you have like general joint discomfort, taking something orally makes sense, right? Because you can hit all of that at one time.
Right.
If your primary issue is vaginal spasm or pelvic floor muscle spasm, maybe you don't want it floating around everywhere else. You can, and it should work or help, but you can do more direct application with the suppository. So,
but the ladies who have like vaginismus, like the severe spasms, like that wouldn't work. Or is the suppository really small and they shouldn't have an issue? Really tiny. Okay.
Yeah, and they can place it rectally.
Okay.
There are topical creams as well. The majority of the ones that I've seen out there are like hot creams or pain creams, like an icy hot type thing. And they work well too. The big kicker here is making sure you find a product that has a carrier molecule in it. It's important to remember that CBD and THC for that matter are lipophilic, meaning they like to be in fat. Our skin is a lipid bilayer, two fat layers backed up to each other. So fat can't, if you put oil on top of another oil, it'll separate out, or oil and water, same deal. So you just have to make sure there's a carrier molecule, like aloe vera works well. You want to find a manufacturer that's actually thought through that. I've run into that a lot in the cannabis industry in Oklahoma, where everybody tells me, oh, I've got a topical pain cream. And I say, well, what did you put it in? Well, it's in beeswax. I'm like, okay, great. So like, how are you going to get it into my muscle or my joint if it's in beeswax? Because that's not going to, cross my skin.
Gotcha.
And they always kind of look at me cross-eyed, but then I always follow up with, well, remember you have CB receptors in your skin. So if you have a topical issue, like a burn or a cut or an abrasion or like nerve discomfort from, say you had shingles or a herpes outbreak or something like that, that you're managing with Western medicine, but you got that like discomfort from the nerve endings, and that's a perfect application to apply CBD topically. But you just have to make sure that they've thought through like the application process. It's more of a medicine and not so much of like the granola cream that you get out of like a state fair market.
Right. Gotcha. And so are there any side effects at all?
There can be. If you take, it depends, like the CBD side, less so. So if you have an allergy to the oil, or if you have acid reflux and it's put in spearmint oil, it can irritate. Or if you have interstitial cystitis or bladder pain syndrome, maybe you don't want something with spearmint oil, as that can be a bladder irritant.
Okay.
Other side effects, what I've noticed is that if you dose the CBD too high, so the dosing is pretty difficult as far as how to walk people through that.
Okay.
And what I tell them, especially with the oils, is to start with about a quarter of a dropper, put it under the tongue for 15 seconds, let it absorb, and then give it about 15 minutes to see what happens.
Okay.
And then dose another quarter of a dropper under the tongue, let it absorb, give it another 15 minutes. One of two things will happen. You'll either get the effect you're looking for, or at some point you're going to start to get a headache. And if you get the headache, then you know that's your upper limit. And so you never want to dose. You want to dose just below that so that you don't have that side effect.
Gotcha. Okay.
Yeah. Other than that, since it is in an oil, if you are taking a large amount, for some people it can cause some GI upset. But overall, our bodies have receptors for the cannabinoids, so the CBD and THC, and the phytocannabinoid that you get from the oil really closely mimics the natural cannabinoid. So it's not like you're adding an extra chemical. It's something that's already there. You're just increasing its availability. And so, yeah, the important thing to remember though with CBD is there's no high associated with that. You're not going to feel gorked out. You're not going to feel hungover the next day when you use it. It works in the time that you use it, and then it's gone.
And it's gone.
So essentially it perpetuates the natural circadian rhythm that your body wants to be in, but not all of us are able to get into.
Gotcha. Now, are there any drug interactions with it?
Yeah, there are. Essentially anything that same rule where if you can't take it with grapefruit, you've probably heard that before.
Yeah,
same rules apply.
Okay.
There are like drug reference calculators and stuff on the internet that you can put in CBD and all the other drugs, and it'll spit out which ones you need to be careful with, like blood thinners and things like that.
Right.
But in general, for most people, it's very well tolerated. It doesn't cause a lot of medication interaction issues.
Okay. And so, and the benefits, they're seen immediately, I'm assuming. Like once they apply it or take it, is it that quick or is it?
Yeah, everyone's a bit different. So for anxiety, people that does CBD oil under the tongue, they tend to get a quick relief.
Okay.
For the pain control issues, like if I get a back spasm or a neck spasm and I apply the cream, usually that will relieve it within 15, 20 minutes.
Okay.
But not everyone reacts the same way. So for you and I, maybe it works well, but you have some other patients that come in and they'll tell you time and time again, it did nothing for me. And that means one of two things. Either they're not dosing high enough. Some people require up to 300 milligrams a day. If you look at a general CBD bottle that you can find at a shop, most people have about 1,500 milligram bottle. So that whole bottle, in theory, is a 5-day supply. Wow. So each dropper isn't 1,500 milligrams, the whole bottle. So if you need a lot, some people do. If you need a lot, that becomes very expensive. Yeah. But that's where cannabis really shines, because you can take in states that have a medical cannabis program, you can add in the THC and it'll take your CBD requirement maybe from 300 down to like 30.
Oh, okay.
Yeah. So it tends to, CBD and THC counteract each other. But from a medical benefit side, they can decrease the requirement of the CBD to get the medical benefit.
Okay, all right. So is there anything else that we should know about CBD oil, whether they're taking it medicinal or over the counter? Both are the same, right? Whether they're taking it over the counter is supposed to be, again, for medicinal purposes, I'm assuming?
Yeah, I mean, it's nothing. Sorry, my dogs are
barking. That's fine. We're all quarantined, I get it.
Must be the mailman, but in general, in states that are kind of new to the CBD THC game, like I don't know how it is in Louisiana, there are people out there that would hunt down hemp flower and CBD because they thought it was going to get them high or provide some sort of recreational benefit, and it doesn't. If anything, it'll just relax you out and help you sleep.
Gotcha. All right. Okay.
The other good thing to remember is with all cannabinoids, we don't have those receptors in our brain, in the brainstem, that control our breathing and heart rate. So if you use cannabis in a vacuum with nothing else, like no opiates, no anything else, you cannot die from it.
Okay.
You can get sick because you took too much. It can make you nauseous and give you a headache, and you can feel, like a lingering effect. but you won't die from it. You just have to ride out that effect and live to fight another day, and then know, okay, yeah, I need to dose down.
Gotcha. Gotcha.
And a lot of people will use cannabis and CBD to down to come off of opiates. So there are mechanisms to do that. You can use them together, but you just need to be careful because opiates with anything, or even like Xanax and those types of drugs, or benzodiazepines in general, have effect on your ability to stay awake, to be drowsy and all that. So
gotcha.
just use common sense.
Yeah.
My biggest recommendation is start low, go slow.
Okay.
You'll know where you hit the dose you need. If you're using it topically, it's almost no systemic absorption, so it's super safe. You can hit your muscles and your joints and things like that you need to be comfortable. And don't be scared of it. It's legal. It's legal in all 50 states. You don't need a cannabis program to do that. You can travel with it. It's really a great option. And just to remember that not all CBD is the same. If you can stay away from isolate, do it. If it's a price issue and you need to use isolate, it's better than nothing.
Okay.
But you might as well maximize your benefit if you can.
Gotcha. And you are in that industry, right? Do you have like a website or something that you sell CBD oil on that you want everyone to know about? Or?
Yeah, we sell it on our Optimal Health Associates website, so you can buy it directly from there, and we'll ship it to people. Hopefully at some point you'll be able to offer that in your practice, and so probably be set up very, very similar. They can either come in and buy it or order it directly from you. You can even go on Amazon if you wanted to. There's 1 million CBD oils on there. I can't promise you anything about the quality, or if it is without THC. It very well may be illegal stuff. What I can guarantee you, if you buy our products or other products similar to ours, is I can track the plant that it started with. We test it before we sell it in our office. We test it after it's batched again. And then if you ding a drug test positive and you try to say that the CBD is what's caused it, I can show you the report. So from a provider and a patient standpoint, you can feel very well protected in knowing that you're not doing anything illegal that you shouldn't be doing. That's not to say that the stuff you find on Amazon or some of these third-party websites can offer the same.
Gotcha. Yeah, well, you piqued my interest when you said pelvic floor pain. I was like, well, I know CBD, to me, it's pretty safe. A lot of people, again, like they think the drug or the cannabis, but I actually use hemp for my son. He had very bad eczema, and it has really done wonders to his skin. Oh my gosh. So, okay, go ahead and tell people where they can find you again on social media.
Yeah, social media is on Instagram, Dr. B, spelled out Dr. B_OKC. You can find me on Facebook at Benjamin J. Barenburg, MD, MS, blah, blah, blah. You can find us on Oklahoma Women's Health Network. You can ask to join there and we'll add you in. I do throw stuff up there about cannabis and CBD. We have a program here in Oklahoma, so I talk a lot more freely about THC products that can be applied to women's health as well. Where else can people find me? OptimalHealthAssociates.com. You can shoot us an inquiry there if you want to purchase CBD products or creams or capsules or whatever. We have that available on there. You just, when I ask you what provider you got the information from, you just click my name in there so that they know that you're affiliated, and then they'll ship it directly to you.
And if they have any questions regarding dosage, can they contact you if they order from your site?
Yeah, probably the easiest way would be to hit me up on Facebook or Instagram.
Okay. All right. So thanks again, Dr. B, for joining us and discussing CBD oil. Again, you guys, you can follow me, Latonya Mister with Soul and Reap Physical Therapy. We're on Facebook, Twitter, YouTube, and Instagram. Like, follow, share, and subscribe. Thanks again. And I forgot to say this on the last video. I want to say thank you to you and all the essential workers out there who are still, putting your lives at risk to help save everyone else. So I really, really appreciate you guys helping out during this coronavirus. So thank you.
We're trying. Hang in there.
All right. Thank you so much.
See you.